Chemical, I'll be on.
Governor's colleagues. Can everybody go on mute, please, if anybody's not on mute apart from me? So, okay, so anyway, welcome to our governor colleagues and any members of the public. So we have quite a busy board agenda, so we'll just press on without any further ado. So in terms of apologies for absence, Russell Hardy is not here. I'm deputising for him, and Adam Carson is deputising for Glenn Burley. And Nick Rees is here deputising for Gertie, Nick Phillip, and Bhaskar for Charles Ashton, as it was this morning. So any declarations of interest? Okay, thank you. Okay. Are the minutes of the meeting held on the 6th of March a fair and accurate reflection of the meeting, or does anybody have any observations or challenges around them? Okay, that's great. Thank you very much. So now on to matters arising. Just bear with me while I catch up myself. So we have 4 complete matters arising, which is excellent. And actions in progress. We have a maternity governance report, Dr. Spraggett and the Clinical Governance Committee to investigate the relevant officers, what the capacity for a safe maternity service would be in order for it not to become compromised. The chief, so David, that's in progress. Have you got anything to add?
It's in progress, yes, it's in progress.
Okay, any idea when you'll be in a position to come back?
I don't know. Fiona, do you know when it might be? Are we going to be at next meeting or the meeting after?
Yeah, we asked for it to come to this next meeting, and I haven't heard otherwise. So that's middle of April to come to clinical governance, and then we'll reference it at next board.
Okay, Fiona, thank you very much.
Yep, certainly an update next board anyway, at very least.
David, thank you. And the other outstanding action in progress is the Chief Nursing Officer to include data on intelligent conveyancing in future reports within the integrated performance report. Fiona.
Yeah, I've struggled with that, to be honest. The intelligent conveyancing data hasn't been forthcoming from West Midlands Ambulance, but we did meet again with colleagues from West Midlands Ambulance last week, and we've linked our information team with theirs, and so I'm hoping that will be available next time.
Okay, thank you, Fiona. We'll keep an eye on that one then. Okay, in terms of Vice Chair's remarks, I'll just note that we had a very positive board workshop this morning. A very interesting patient story regarding our out-of-hospital division. And it concerned a 20-year-old patient who was dying and wanted to be able to go to Iceland and subsequently to Holland to make the most of the remaining weeks and months that he had. And it was an interesting lesson in how challenging it can be sometimes to offer personalisation around care, but the importance of delivering personalisation, the value to the patient at end of life, and indeed the value to the whole system, ultimately in personalised care, in less attendance to acute hospitals and A&E, etc. So that really was a very interesting thing. We then had a discussion supported by the ICP around prevention and the importance of addressing health inequalities, which is an issue that SWFT is very firmly signed up to, and that was a constructive discussion. And there was also within that meeting a strong focus on continuous improvement within SWFT, and there's good evidence of that going on, and good control financially over what's going in the organisation. And indeed, there's good evidence there too. So a very productive meeting this morning. So without further ado, then we move on to items for approval and the draft annual financial plan. Kim.
Thank you, Chair. So the report there sets out draft financial plan and it is still draft, even though we're already at the beginning of the financial year, and that's because we're still in negotiations with the ICB around getting our share of the growth funding. So we are presenting a plan that reports a £12.5 million deficit, having a set of plan to deliver a £20 million cost improvement efficiency programme for the new financial year. So it is going to be a challenging financial year, not just for us, but for the NHS. I think the planning guidance at the time of writing was not released, but it was final guidance was released the Thursday just before Good Friday. So the respective teams are just working through in terms of what does that mean for the plan moving forward. The final plan is not due for submission until May. So the next few weeks are critical in terms of making sure that we drive through, and understand any sort of remaining cost pressures for the divisions, but equally to finalise discussions with the ICB. There is a requirement for the ICB to deliver a break-even plan. But it is a challenging position, I think it's fair to say, overall for this ICB and indeed for many other ICBs. We remain as an organisation who obviously wishes to ensure that we've got good financial grip, but obviously we need to ensure that we get the right allocation to deliver the services that we're required to provide. So that's the situation that we're in at the moment. We will bring a further update, obviously, to board as we progress discussions over the next few weeks. But so the plan's there as a draft for the time being. Thank you.
Thank you, Kim. Thank you very much. Any questions or perspectives for Kim? Adam.
Thanks, Kim. Very supportive of the paper, as you know. I just wanted to highlight that those conversations with the ICB around growth funding are really important. We have seen the impact of growth in our services, I think notably through the front doors in ED, and certainly we've seen growth there that is significantly higher than other partners in the ICB. So we do need to make sure those discussions happen over the coming months, and I know you're on those, but supportive of the plan, Kim. Thank you.
Thank you, Adam. Okay, if there are no more questions or perspectives for Kim, we'll move on to Sophie and the annual capital programme. Sophie.
Thank you. So hopefully Bob can see here, we've got a programme set out with what we know today. We're asking for approval for that today so that we can continue the projects that we've already started and enable our teams to start delivering on sort of medical equipment purchases to get them spent in year. What this paper also does, though, is hopefully give you the assurance around the robust processes we put in place around prioritisation. There were two projects that last year we had to stop and they were presented to board, which was plain film and maternity theatres. They're both red risks for our organisation. This draft programme is recommending that plain film is included in the spend this year. But you can also see that maternity theatre scores as the second highest priority in terms of if additional funds are available throughout the year, that is what we would like to proceed with. It also identifies the other red risks that we're carrying in the organisation that are linked to estates. It's fair to say there's a much more detailed paper that has gone to management board that details the ambers and the dark ambers. There's about 50-ish risks associated with our estate. What this doesn't do is address any of our risks around community estate, and I know that has been a topic of conversation more recently. We are aware of what those risks are, but we are unable to invest our own capital in them. We're working with the Integrated Care Board around where we can release funds from NHS Property Services buildings, about reinvesting them back into some of our community estate, as well as working with some of our partners about how we use estate as a system to address some of those risks that we're seeing in community. Alongside the prioritisation in this paper, there's a separate piece of work that Steve Clark has led, following the same process as George Eliot, to prioritise our medical equipment. So should funds become available and we're able to release more to medical equipment, there is a prioritisation of the next highest area of need for that as well. So we're going into this year in a very robust way, I would say, in terms of that piece of work. So the paper's here for approval of that programme as it stands today with what we know, but also just to note the processes that we've got in place. We're going to have to be quite agile again this year, I think, to respond. We're getting used to that, but there is a risk that we may need to bring things back to the board to get approval ahead of knowing if we've got funding, just so we can keep on track. Happy to take any questions.
Thank you very much. Thank you. So before we go, ask for approval for Sophie's programme, any questions or perspectives? Yes, Sue. You're on mute.
Yeah, thank you, Sophie. I support the proposal, but my question is around maternity theatres. It's really, I'm saddened to see that it didn't hit the benchmark, but I do appreciate and support the exec's careful work on prioritisation. I'm just aware that the risk nationally on maternity is so high and that we have been doing well, but that the CQC are likely to include environmental factors in their responses to the reviews that they've been doing over the last 18 months. I've heard that. So I'm just wondering, how will we resource this? What are the routes to be able to go to it during the year if we wanted to? Where are the capital routes? Is there any clarity on where it might come from?
Thank you, Sue.
So maybe, so if I start, but Kim, I don't know if you wanted to add to this one. I guess that is the position, Sue. We're not clear on how we can afford that one this year. We will, of course, we are in the best position. We've got an approved business case. We know how much it's going to cost. We can do the work, and the team have got the plan in place that will mitigate any operational impact of it. So we're ready to go, which puts us in the best place. We will look for funding this year in terms of national funding. Any funding coming down that we can apply this project to, we will do that. There's obviously an element of charitable that we might be able to go for, but not the 2.8 million. So it is a risk that we're carrying, and it is a risk, I think, to, if we did have that assessment, that we would score down on the environment for that.
Yeah.
Okay.
Do you want me to come in? But yeah, I'll just reiterate what Sophie said. But again, you'll be aware that we've been trying to seek additional resource by doing well in terms of our ED performance. So we're waiting to hear whether or not we've been successful. You'll be aware of the schemes that we're doing to try and get some non-recurrent funding that we may choose to elect to choose as a capital gain that will help. So there are options, but clearly they all need working through. So we're not at the place at the moment to say that we have definitely got sources of funding that we can relook and reprioritise our programme, but they're definitely things that we've got in play at the moment.
Okay, thank you, Kim. Any more questions or perspectives for Sophie? So Sophie, we need to approve your programme, don't we here? So if you're not happy to approve Sophie's programme, please raise your digital hand. Okay, Sophie, the programme's approved. Thank you. So item 6.3 then, Sarah, is the Code of Governance for NHS Provider Trusts, the annual compliance review.
Thanks, Simon. So as the board's aware, the new Code of Governance for NHS Provider Trusts was published last year. We are required to do an annual review of the trust compliance to declare in the trust annual report. So the analysis against all of the provisions of the code is detailed in the report. I'm proposing that we declare non-compliance against provision 2.7 in section B of the code, which relates to non-exec independence, and that's because of our appointment of Pramjit as the nominated non-exec from the University of Warwick, which is obviously a key role for our collaborative work with the university. So it is relevant, and therefore we can declare this under the comply and explain approach. The analysis has been considered by the audit committee and they are supportive of the recommendation as proposed in the report. So seeking approval, please.
Sarah, thank you very much. Any questions or perspectives for Sarah on this report? Okay, thank you. If you're not happy to approve the report, please raise a digital hand. Okay, super. Thank you, Sarah. That's approved. Thank you very much. And then we are on to the annual review of, Register of Directors and Register of Directors' Interest. That was a mouthful. So back to you again, Sarah.
Thanks, Simon. So all of the board members, voting and non-voting, have completed updated declarations of interest, which that information is captured in the Trust annual report. So this is for approval on this occasion because of declaring the information in the annual report. Thank you.
Okay, thank you, Sarah. I assume there are no questions or perspectives, in which case, if you're unhappy to approve this, please raise a digital hand. Okay, that's approved, Sarah. Thank you very much. So we then move on to the performance review and assurance section. Item 7.1, which is the Chief Executive's report. Adam.
Thank you, Chair. So I will point out some highlights from the report. Firstly, the staff survey. We have a larger agenda item on this later, so I don't want to steal thunder too much, but I do want to note here SWFT's positive performance in the staff survey, particularly the ranking within the top 5 by staff of best acute trusts to work out, which I think is a really considerable achievement. And reflective of the culture in the organisation. So great news. We've also seen improvement across the people promised domains, but more about that later. I know Glenn would also want me to highlight the performance across the group, and I think it's particularly notable that the two most long-standing members of the group, George Elliott and Y, have had very positive performance, and George Elliott in particular has seen a considerable performance improvement in the results this year. Worcester is in a slightly different position, obviously a new member of the group, but a real area of focus for them for the year to come. The report also highlights the budget and the impact of the budget on the NHS. So in headlines, we know the budget included 2.5 billion of revenue funding for the NHS, but that effectively provides for a flat cash position in real terms, covering inflation and pay awards. It isn't yet clear, or certainly at the time of writing, it wasn't clear how that would support performance improvement and waiting time reduction. It is important to note, though, that the draft, the financial planning guidance was released to trusts late last week. So we continue to work through that document to understand the impact for us. The budget also provided for 3.4 billion in technology development funding, doubling investment in these areas, and I think that supports our strategy, particularly around automation and other work we're doing. As a trade-off for those investments, there was a renewed commitment to productivity, and I think we'll hear a lot about this over the next year. The government expects productivity to unlock savings over the coming years, and certainly our own plans are developing for this year, as we have delivered well in these areas in previous years. In other headlines, the budget provided £35 million for maternity safety, with some specified areas of work there, as the report outlines. As I've mentioned, productivity, this isn't a surprise for this year. We already do compare favourably in terms of productivity, but there's always more we can do, and we've embedded it into our trust objectives for this year. Glenn has been talking to the NHS, to NHS England, about measurement of productivity and advocating a more incentivised approach for productive organisations, really with a fear that in recent years we've moved in a direction of a financial regime that really awards those who are spending rather than those that are productive. So that those discussions continue. we are expecting national dashboards relating to productivity based on model hospital data. And for some time, we've been working as a group on this. And in fact, in recent months, we have put in place a piece of work led by our group clinical and group financial advisors, looking at, for each of the trusts in the group, the top areas of potential productivity improvement, and that work is now filtering down to our operational teams, who will be focusing on it over the coming months. I just want to give a bit of a plug for the Group Improvement Week, which is coming up in May. So continuous improvement is something we do well. It's a mantra for us in the organisation and across the group, and we know it's really delivered for us in the past. At the Improvement Week event in May, staff across the group, including myself, will be sharing our experience and some of our good stories and some of our failings even in improvement, with really the aim that we can learn from each other, we can share initiatives, and that we can really show that strength as a group to focus on improvement. So I look forward to that happening next month. Finally, in more from our great teams, there is some information about Victoria Ward. Victoria Ward is a 21-bedded unit at Warwick Hospital looking after frail patients, and it's really transformed over the last year. There's been a number of refurbishment initiatives. We've used charitable funds to improve and enhance the environment for patients, to provide a bit more of a welcoming and distracting environment that promotes mobility. Plug for the ward manager there, Helen, who is doing fantastic work with that team, along with everyone else working there, and a number of new ways of working they've established, such as an approach to preventing pressure sores. It's a great ward, and it's good that we're highlighting the work there. Those are the key items in the report, but I'm of course happy to take any questions.
Adam, thank you very much. So any questions or perspectives for Adam? Okay, so Adam, with your other hat on then for today, we begin the performance and the integrated performance report and the relay race around your executive colleagues on what's going on. So we'll kick off with the MD report. Thanks.
So a brief summary before I hand over to colleagues. Again, it's been a busy month. Reassuringly, we saw, this report covers February, of course. Reassuringly, we saw an improvement in performance in the ED 4-hour wait target, supported, of course, by our out-of-hospital teams, who've continued to deliver extremely well, and supported across the hospital, recognising that flow and ED performance is a whole hospital target. We also saw high levels of elective activity and a sustained increase in our cancer referrals, which I know Harkema will cover more as part of her report. I've mentioned the staff survey, but it's really reassuring to see how that triangulates with our other workforce indicators. So, for example, we have decreased turnover, a sustained decrease in turnover, and positive recruitment indicators across the board. As Kim has outlined for next year, the picture is challenging financially, but we do predict an end of year break-even position. I think in summary, that's all I'll say, but I will hand over to my exec colleagues for the detail.
Adam, thank you very much. Before we do, any questions or observations for Adam? No, other than getting to a break-even situation is no mean feat this year, Adam, which is very good. So moving on then, Bhaskar and Fiona on quality and safety.
Yeah, just some of the paper just outlines a summary of the main indicators that we measure as mandated fields for quality and safety. And as you can see from the SBC charts on the right hand side, there's no significant variance from sort of normal state, with the exception of VTE, which we have seen a drop in compliance around risk assessments, but my ACMO, sorry, our Associate Chief Medical Officers are working to improve that back to a better performance. But apart from that, there's nothing new to report. Thank you.
Fiona, thank you. So any questions or perspectives for Fiona and Bhaskar? Okay, thank you. So we then move on to Harkamel to talk about an exceedingly busy ops picture, especially in A&E. So Harkamel.
Yeah, absolutely. February was another bumper month for us. We did see a significant improvement against our 4-hour standard, which I'm really proud of, and we achieved 77.2%, which is above the 76 standard. In terms of activity, our type 1 activity, and that's our they're our poorliest patients, so our true A&E activity attendances hit a new high with an average attendance of 267, which is quite a significant increase when you consider the size of our A&E here. And 5 days out of February, we had attendances over 300. And when I started in post, I used to say 270 was a record month. So the scale of the growth is significant, and to have 5 in 1 month when you compare it to 12 over the year, I think really goes some way to tell you how busy the front door was. Same-day emergency care remains a key area in terms of helping us manage some of this demand, and we had 42.6% of our ED admissions go to these areas, which is brilliant for patients, because we do know that if you can stream patients to same-day emergency care, they have better outcomes, shorter length of stay, and we can treat them much quicker. We also had an exceptional month for elective activity, and we achieved 116% of our baseline activity recorded, which was the equivalent of 136% of the financial baseline. So despite the operational pressures facing the front door, we kept all our electives going and managed to continue to make gains there. We did decline a little bit on the 18-week referrals treatment, but we, in terms of our long waiting position, we still don't have any patients over 78 weeks or 104 weeks. We do have patients over 65 weeks, and I will come to that in a moment. Diagnostics remains a challenge, and in terms of cancer, we've landed where we thought we would, in that we knew we'd see a bit of a dip over Christmas. And so we did drop with our 28-day faster diagnosis standard. So that's the standard around 75% of our patients need to know within 28 days whether they have or have not got cancer. But we do remain on trajectory to meet that target, which in my opinion is one of the more important ones. And then I've put a little bit more information in terms of some of the referral numbers, and as you'll see, they continue to grow. And in a couple of months, I'll bring back another focus slide so that people can see the scale of the increase. Out of hospital performance remained strong, and that was vital to us, ensuring good flow in February to try and move our patients and keep them flowing through the organisation. I've included then a focus slide about orthodontics. So as an organisation, we have been on track to clear our longest waiting patients and have met all of the sort of requirements set out. So we didn't have any 104, we didn't have any 78 weeks, and we have been struggling with orthodontics, and I've referenced this in my board papers, but I wanted to just pull it out as a focus slide because it feels really, really important to me. And I'm really sad to say that as of the end of the financial year, so as of the 31st of March, we had 81 patients who were waiting over 65 weeks for orthodontics. So we didn't have any patients waiting over 65 weeks for any other specialty, but orthodontics remains a real pressure point for us. SWFT is the only secondary care provider of orthodontic services within the system, so within Coventry and Warwickshire. And nationally, there aren't very many providers. And certainly when we've asked for mutual aid, you know, the picture is sort of replicated elsewhere. It's really fragile and is recognised as such. There are risks associated with this, and I think sometimes orthodontics it's almost kind of minimised in that like the severity isn't always understood. But a lot of these patients are young patients, and so obviously their physical health is impacted. But equally, there is a mental health impact. I feel quite strongly that these are for our young patients their first interaction often with NHS services, and this could then affect confidence with services and how patients then you know, use the services moving forward, which I think it's really important that we get that right. There's the clear reputational risk. You know, it's I'm really sad to say that we've had 65-week breaches because we were on track to clear those, and we don't have the solution just on our own. So we are working with NHS England. So the issue that is driving this is consultant recruitment. We've had quite a lot of sickness and maternity leave in terms of our consultant workforce and people going part-time. So we're currently at a single-handed service, and clearly, you know, with any single-handed service, there is a risk of burnout for that individual. We've been working with NHS England to try and help us find alternative providers and alternative pathways so that we might be able to commission new providers so that patients can hopefully start getting treated. And we have currently closed the waiting list to new patients, albeit we are triaging that waiting list because those patients are still sort of stacking up on a list to just make sure that there aren't any urgent patients within that cohort. There is a longer term view that we want to implement different ways of working and think about how we might be able to use therapists and tech. But for the moment, this is the position where we're at SWFT. So we are meeting weekly with NHS England, so it's very much on the radar, but I just wanted to bring it to the attention of the board. Thank you.
Thank you, Harkamal. So any questions or perspectives for Harkamal? Okay, Harkamal, just for information, what proportion of our A&E visits, we've got a higher number of out of area attendances, haven't we, than we would normally expect at the moment?
We do. We have a significant volume of out of area patients. We did have a slide. I'll put the answer to that in the chat because I've got the exact answer. But one of the reasons that we've been really struggling this year, as in 2024, is that continued drive to out of area patients. And certainly in February, in February and in March, we were really struggling with extended length of stay, notably from the Birmingham Solihull area. That said, over the past weekend, we've had ambulances arriving from outside our region and patients driving from as far as like the other side of Leicester to access our services because they know that they would be waiting considerably longer in their trusts. And then we've done that. We're starting to do that analysis in terms of what that then does for our length of stay, because what we know is when patients come from out of area, especially our more frail patients, discharging them back to their packages of care becomes really challenging. So we've seen a significant increase year on year, but I'll get you the exact figure and put that in the chat.
Okay, thank you. Richard has put in 83 at the last F&P, so just sort of, okay. Harkamal, thank you very much. So we now move on to our workforce and Nick. Thank you, Nick.
Thanks, Simon. I'll take the report as read. As sort of Adam referenced, it's generally a positive picture for the workforce KPIs, turnover, mandatory training, appraisal, vacancy rates are all in the green. In terms of picking out a positive, I suppose that we've maintained our performance on appraisals, which is above the trust target for the second consecutive month. Follows a concerted effort by the divisions, obviously, over a challenging period, including industrial action. In terms of an area for focus, worth noting that this absence is above the trust target for the most recent figures, primarily driven by short-term sickness absence. In terms of actions in response to this, we're in the process of reviewing our absence management policy alongside staff side colleagues with the idea it provides greater support and clarity both for managers and for staff members going through the process. The idea is that will help drive down absence rates. It's also worth pointing out there's an ICS-wide focus on absence management, and a task and finish group's been set up from the workforce leads from all of the providers, with the idea of sharing best practice and trying to reduce absence levels across the region. So it's not just us that have sort of are a bit of an outlier in that respect.
Okay, thank you very much, Nick. So any questions or perspectives for Nick? Okay, so we're now on to our financial performance, and Kim.
Thank you, Chair. So just to remind board members that the latest plan that we submitted back in November said that we would deliver a break-even plan, but we would not be able to mitigate the cost of any further strike action. And indeed, there were further strikes announced in December, January and February. However, since then, we have now had confirmation that we would, and we have indeed received £1.5 million of funding for the strikes for those periods. That's helped mitigate the position, but also the ICB has also helped contribute the remaining £500,000. So on that basis, we're now saying that we are in a position to try and deliver a break-even plan for the outturn for the end of the year. We're obviously finalising the outturn position, but at the moment I'm expecting us to be on the right side of break-even, and we're obviously just finalising the accounts ready for audit at the moment. So busy period while we're still managing negotiations for the plan for next year as well. cash position, I think, remains strong. We did forecast that we'll be below the sort of £20 million mark for the end of March, but actually through good cash management, we're looking at an outturn of about 22 million. So that's in a better, stronger cash position than I'd originally planned for. So that's a positive thing as well. The only other thing to highlight really is around we were able to broker the capital into next year, so that's been successfully actioned as well. So that puts us in a strong position, obviously, into next year, because we haven't lost any of our capital expenditure limits for capital as well, which is a positive thing. The other thing to highlight is we have seen the fourth month really of consecutive reduction in agency spend, which is a real positive really for the organisation, and we continue to drive that moving forward into the new financial year. And we've obviously got some challenges that we've touched upon earlier into next financial year, but work is underway around engaging in the productivity agenda and targeting hotspot areas where we've got some challenges moving forward into next year as well. Happy to take questions.
Super, thank you, Kim. Any questions or perspectives for Kim? Sue.
Yes, Kim, I think you just covered it, but I just wanted to make sure members of the public are assured on agency. It's been a good performance this year on agency reduction, and the trajectory is good. How assured are you that the grip is in place to meet potential national constraints on agency, which are in the press at the moment?
Yeah, we've got a number of work programmes. We've got procurement engaged in terms of making sure that the rates and agency rates are reduced. We've got a plan in place to ensure that we are stopping the use of any off-framework agencies as well. And there's a letter stating that we should not be using any off-framework agency by July. So we've got plans in place to do that, because obviously that's a national dictate, and we'll be trying to ensure that we enforce that as well. And we also continue on our longer term strategy to ensure that we minimise any agency, particularly in our medical areas.
Okay, Kim, thank you very much. So if there are no more questions for Kim, we'll move on to Bhaskar and learning from deaths. Bhaskar.
Yeah, I take the report in red. Our SHIMI data continues to be within range, although the trend was slightly up, and there's been some deep dives on the 3 focus points of sepsis, pneumonia, and AKI, and there have been a few remedial measures put in place. Even though it's not published, the specific SHIMI data is already downtrending on the latest, and we're continuing to work with our coding team, clinical teams, to try and unblock any potential signals we're getting, and we continue to give you the assurance that we have a firm grip on where our weaknesses are and remedies are being put. Thank you.
Thank you, Bhaskar. So any questions for Bhaskar? Okay, Bhaskar, thank you very much. So that then we move on to Fiona and the patient experience quarterly report. Fiona.
Yeah, so I take the paper as read. This is a summary of our corporately captured data around patient experience. Again, as in previous quarters, the position looks good for the number of people that have a good experience and provide positive feedback about that experience to us. But we do still have some people that have need to complain, and we always investigate those and action any learning with the individual teams or as a corporate improvement project. We have had an inspection in the last quarter from the Human Tissue Authority, and that went well, and there was significantly positive feedback from both the inspector and from our partners across the system. And we have also increased the number of people that are giving us feedback through some of our inpatient services, and that is set to be expanded out to outpatients and community services in time. But happy to take any questions.
Thank you, Fiona. So any questions or perspectives, Fiona? Oliver.
Hi, Fiona. Just quick one for me was the Bluebell Birth Centre seemed to have relatively high complaint level. Given that your paper later on in this meeting, is there a cause for concern here, or are you happy?
No, I think I'm happy. I think that's skewed by the number of patients that go through Bluebell so the percentage, if they have relatively low numbers at a denominator, often look skewed. But I'm not concerned about Bluebell and the experience that people have through there.
Fiona, thank you very much. Okay, if there's no more questions for Fiona, we'll move on to item 7.4. The CQC maternity survey results and action plan with Lynn Ward.
Yeah, Lynn's here. Thank you. Hi, Lynn.
Hi, thank you, Board. This is
Hello,
for information. So the CQC published the results of its annual survey of women's experiences of maternity care in England. That was published back in just February 2024. Families were asked questions about all aspects of their maternity care, from the first time they saw a clinician or a midwife during labour and birth, right through until the arrival of their baby. And post-care after that. The survey was open to all women over 16 years of age who had a live birth between January and March 2023. And as such, the survey results should help us to effectively target our areas of maternity care that we need to improve. From the latest survey questionnaires that were sent out to 299 service users, we had a response rate of about 54%, so about 161 responses, so not as high as we would have liked. And there was 109 questions, and obviously, as you can imagine, it's a busy time when you've had a baby, so we never expect a really high response rate, but it is significantly low. So SWFT scored in the middle range, about 60% range of all the trust surveys. 3 of the scores we were in the top 20% range, which is really good, and our best scoring was were you involved in the decision to have an induction of labour, which is really good. However, 22 of our scores were in the bottom 20% range, and these spread across the sections from labour and birth of your baby and some of the care after birth. Compared to 2022, 36 scores though have improved and 13 sadly have declined. So what we've done is we've compiled an action plan, and we've actually still built on our actions from the 2022 survey results, and we've now got an action plan that's included for your information, and we'll move forward with those, and that will be monitored through our divisional governance forums. And I've attached the action plan for your information. Happy to take any questions.
Lynn, thank you very much. So any questions or perspectives for Lynn? Okay, Lynn, thank you. So we'll then move on to the Green Plan update with Sophie.
Thank you. This report shows the great progress we've made on the Green Plan as we go into the last year. I've taken out, to keep the report short, all of the data and information on the amber and green, but if there is anyone that is keen to see that, I'd be happy to share that. And instead, we've focused on the areas that are still left in the Green Plan that we're concerned we might not deliver. So there's 8 areas that we've classed as red that won't be delivered by the end of the Green Plan period. Since this report was written, 3 of those have moved to amber, which is the top 3, which leaves us with 5 really to focus on, about whether we can mitigate or move those into the right space by the end of the year. That being said, this report hopefully provides the board with quite a lot of assurance that we're moving in the right direction of travel. As we go into this year, we need to do quite a lot of work now around setting the ambitions and the targets for the next 3 years, aligned to the Trust's big move around leading the NHS in this area. In particular, there's challenges for us to sort of spend some time on this year around the currency and how we translate this into something that matters to people and people can really engage with. And we've had some really great support from Phil on that, in terms of just sort of us reframing our thinking and not calling it the Say Let's project anymore, but talking to the hearts and minds of our staff, really, especially today when the heating's off and everyone wants to put it back on. So hopefully this report assures the board really we're moving in the right direction. There's always more we can do, and we'll look at those 5 areas by the end of the year.
Okay, Sophie, thank you. So any questions or perspectives for Sophie? Okay, so that then moves us on to Sarah with the annual report of signings and ceilings.
Thanks, Simon. So this report's just for information, so happy to take any questions or comments.
Sarah, thank you very much. Any questions or comments for Sarah? Okay, so without further ado, we're on to David Spraggett and the Clinical Governance Committee report.
Yeah, happy to take the report as read. The only thing is there is a typo in it. The areas of concern for board's attention in the item 5, the backlog is actually in colposcopy and histology reporting, not colonoscopy. Similar sort of direction from the body, but obviously a different issue completely. But I'm happy to take any questions.
Okay, David, thank you. Any questions or perspectives for David? Okay, so just bear with me while I catch myself up. My agenda has suddenly disappeared completely here, so bear with me. So it's the year-end position of the annual trust and foundation group objectives.
Thank you. Thank you, Simon. So the report highlights our progress with the objectives we set at this time last year, and board members will be aware that we refreshed our strategy last year, and as a group we established 5 big moves, which our objectives were aligned to. As the report shows, we made really positive progress against those objectives, and I think when you triangulate that against the staff survey, operational performance and financial performance, it really shows how much we've achieved as an organisation over the last year. I'm not going to go through each of the objectives in detail, but if I just group them and share some highlights. So the first 3 objectives demonstrate our focus on workforce, recruitment attention and flexibility, and highlight the success of the plans we put in place really to respond to the staff survey and the recruitment challenges generally in the NHS. Objectives 4 and 5 highlight the establishment and success of the Community Recovery Service jointly with the local authority that has really supported discharge and flow across the organisation, and shown how we can support and assist the domiciliary care market. Objectives 6 and 7 show a refocusing through our planning group and Excel in Everything programme in prevention initiatives, and they show the work we've done with partners across the system and at place, noting in particular the South Warwickshire Place plan, which has been refreshed over the last year. But it does highlight that there's more work we need to do around prevention. I think this will be a continuing priority for the trust, and something in particular that will come out through the Community Integrator programme, which is the new contract for out of hospital services, which we are the lead provider for. Objective 8 demonstrates some of the work we've done to embed an information culture across the organisation, including implementing population health management and supporting that programme across Coventry and Warwickshire, and really making sure that we are using and managing data in all aspects of our work as an organisation. We've heard about objectives 9 and 10 in update Sophie's just given, and the good work we've got and done in embedding the green plan in the organisation. And clearly there's further work to enhance this next year, features in our objectives for next year, where there'll be a focus on small behavioural changes and really embedding the decarbonisation programme. 11 and 12 highlight some of the transformation work we've done in the organisation, in particular the success of the frailty service, which has been fantastic. And 13 highlights the excellent work we've done on improving theatres utilisation, for which we're now in the upper quartile nationally. So great work there by our Ops and Theatres team. Number 14 is our only red rated objective, and that relates to our EPR programme, noting that our implementation as per the objective was reliant on UFTW going live. We're going onto the same instance of the EPR as them and following them, and they have delayed their implementation from last October to next June. So we'd anticipate our work would commence this financial year now, I should say. And finally, objective 15 highlights our continued positive work on research and the developing and firm relationships we have with the universities in Warwickshire. So that's all I wanted to highlight, Simon, but I'm happy to take any questions.
Adam, thank you very much. Is it fair to say, Adam, before we have questions, that our view on EPR has improved and we're more comfortable that we're going to make the progress we want to make with EPR now?
Yes, absolutely. So we are progressing our plans to implement an EPR jointly with UHCW, and we have forming joint governance, which we hope to finalise over the next month or so.
Thank you very much. So any questions or perspectives to Adam? Okay, so we move on to the risk management section of the report and the board assurance framework and quarterly risk report, which is still with you, I think, Adam.
Yes, thank you, Simon. So the report highlights the board assurance framework, which is strategic risks associated with our objectives, as those objectives are in quarter 4 near complete on delivery. As you'd expect, there are less risks on the BAF than usual. Those are highlighted in the report. The report also includes our register of red risks, so that's risks in the organisation we're rating over 15, and that is there for board members' information. I won't go into any further detail, but I'm happy to take any questions.
Thank you. So questions and perspectives for Adam. Okay, so summary items for noting then. Summary of ratified policies. This is becoming the Adam show here. Adam, back to you again.
Another brief one. Thanks, Simon. So there were 2 policies, both of which were relatively minor updates to existing documents.
Okay, thank you. And then we move on to the staff survey results. So this is Nick and Adam, I think, to talk us through them.
Yeah, I will kick off, and Nick will take the detail. So I won't steal too much of his thunder, and I've already noted the good work on the staff survey. I think the thing I want to say in summary is we regard the staff survey as one of the most important indicators of an organisation's culture and performance, really, because we know that the position and feelings of our staff really affects and impacts how we provide patient care. So it's a really critical thing to look at in an organisation, and we're incredibly pleased that we've seen improvement across the domains in this year, and particularly, as I say, that point on recommending us as a place to work. There are always things we can learn and improve on, though, and certainly there are some of those highlighted in the staff survey results. So I will hand over to Nick, who will get a bit more into the detail. Thanks, Nick.
Thanks, Adam. Yeah, and as Adam sort of referenced, on the whole, generally, it's very good results. We sort of improved across the board for all of the divisions, across all of the people promises as well. Just to pick out a couple of key good areas. So in terms of the We Work Flexibly people promise, was one of the areas where it had significant sort of improvement based upon last year's results. and that ties in with our sort of strategic objective to be a very flexible employer, and the work we've done around that, which we know has an impact on retention, work-life balance, health and well-being for staff, and is always important for us in terms of trying to be that employer of choice for people to stay here. Linked to that, there is also a significant improvement in the responses for staff, saying that there's sufficient staff for them to be able to do their job, which ties in obviously the work we've got around retention and the recruitment that we're focused on in terms of our reducing vacancy rates, and that allows staff to have a more positive experience and translates into better care. In terms of sort of like in areas for improvement that came out from the staff survey, this was primarily around sort of like the WDES information. We've had a sort of a small increase in staff from minority backgrounds with long-term conditions reporting that have a less positive experience than other colleagues, and that's sort of overall that's showing that the bullying and harassment figures are higher than we would have liked. So that's certainly an area that we're going to focus on when looking at the action plans. And we do have specific plans around that in terms of our ED&I action plan, anti-bullying work and work linked to civility and freedom to speak up over the next 12 months. But to end it on a positive, as Adam said, generally these are very positive results. We're in the top few of the country for this in terms of some of our indicators. So very positive, really. Happy to take any questions.
Thank you very much, Nick. So questions and perspectives for Nick. There we go. So Sue.
Yes, just a perspective from me. Just to pick up from your final points there, Nick. It is important, and I know that work is underway on bullying and harassment, particularly with the ethnic lens on it. I think it is encouraging that our freedom to speak up scores at staff are increasingly. We've done well in that area. We must continue to do well. So just to call out to make sure that staff are aware that you must speak up about these very difficult areas, because when we know, then we can do something about it. And then my second point is that I just wanted to thank the executive team and all of the team at SWFT. I think these are a phenomenal set of results. And when we look at them against the backdrop of the pressures of the health service in general and the financial performance and activity performance and productivity of this trust, I think it's a real testament to everybody's leadership. So well done.
Indeed, well said, Sue. And I just say it's worth looking at page 189 of the report, where it's the significance testing section of it, and it shows on how many occasions there's significantly higher recognition now than there was this time last year, whether it's on recognition or an always learning organisation, or indeed the morale of the organisation. So I think that's very positive. Ollie.
Yeah, just to echo what Sue's just said, really, in terms of if one were to read some of the papers over the last 4 or 5 months, it wouldn't necessarily paint the NHS as a great place to work, but SWFT certainly bucks that trend. And I think incredibly proud to see these results. It really echoes with what we're seeing when we visit different sites of SWFT. Every time I meet a member of staff at SWFT, they tend to be really happy, and so it's good to see that sort of triangulation. One thing I think from my sort of half external point of view, I don't think as an organisation we bang on enough about this. We're top 4 in the country, and I'd like to see more of that. I think there's a lot of work that can be done on employer brand, because if I was a clinician looking to work somewhere in the Midlands right now, SWFT would be number 1 on the list, and I think that's the shoes we need to be thinking in.
Okay, good point, Ollie. Thank you. Okay, I mean, I think what Adam said is right. These are an exceptional set of results, and we should congratulate ourselves really heartily for this. But we mustn't lose sight of the fact that we can still do things better, and we must be honest with ourselves and look at those areas where we can do better. But we are doing extremely well. So that moves us on now to Harkamal and the 6-monthly nutrition standards report. Harkamal.
Yeah, so this is just here to update where we're up to with our nutrition standards. So I won't go through all of it, but the only bit I wanted to pick out was that we had the Food Safety Awards hosted by ISS in London in March, and the catering team at SWFT were awarded a gold star for achieving 95% from the auditors for the food safety inspections, which I think is brilliant. And our patient catering manager was awarded Patient Catering Manager of the Year. So very well done to the ISS team.
Yeah, very good indeed. Very well done. Harkamal, thank you very much. Any questions or perspectives for Harkamal? Okay, so that moves us on then to board committee minutes. We have the Clinical Governance Committee of the 14th of February. David, is anything you'd like to add to that?
No, there's nothing really I need to add on that.
Okay, and any questions or perspectives from people around those minutes? No, okay, that's lovely. So I think, Sarah, since I don't have an agenda, it's absolutely disappeared entirely. I think we're on to questions from the governors and members of the public. Is that correct?
We were on any other business first, Simon.
Thank you. Okay, any other business? Right, then we are indeed then on to questions from governors and members of the public. I think I'm aware of only one question from a governor, which is Roger Lloyd, and I think, Adam, you're going to take that question.
Do you want me to read it?
All right, Adam's looking very blank at me there for a second, but go on, read it.
I am, but Sarah, could you give the wording of the question? I don't have it in front of me.
Yeah. So Roger says that whilst the results of the staff survey are impressive, it is to be regretted that the results for BAME and disability discrimination are out of step with those for the white communities. What processes can be brought to bear to level up these results, as this level of discrimination has no place in the 21st century? Thank you.
Thank you, Sarah, and thanks, Roger, for the question. And I couldn't agree more with the sentiment, really. It doesn't have any place in SWFT or anywhere in the 21st century. And while the staff survey particularly points out race and disability because of their links to the WRES and WDARES, I think the same is true for all protected characteristics and all minority groups. We touched on some of the work particularly going on as part of the staff survey update, but this is certainly an area we take seriously as a trust. In the last 6 months, we've recruited an EDI advisor, Ola, who has really helped us put together our action plans. And we are seeing real progress. So we've had some really good staff events actually talking about particular issues relating to these groups. So we had a couple of weeks ago a week on disability and neurodiversity. We've had Transgender Awareness Week and a number of events, and we had the week on Race Equality Week, where we had a series of events every day to share experiences and share learning. We've obviously also got training on civility. We've done quite a lot of work, including sessions for the board on EDI and microaggressions. And really, this is something we'll keep plugging at and need to keep plugging at, I think, led by the work Ola and team are doing. But it certainly is important, and we need to keep making sure we're raising the profile and raising the message and all learning, because as Roger says, this has no place in SWFT or in society.
Thank you, Adam. Quite right too. Roger, thank you for your question. Sarah, are there any more questions that I'm not aware of?
No, Simon.
Okay, thank you very much. So I think then that is the public meeting closed, and we'll move on to the confidential meeting. So can I suggest we have a 10-minute break and come back at 3:10 for the confidential meeting? Okay, thank you.